Today we're digging into something really quite interesting, maybe even a bit paradoxical, happening in global healthcare. Specifically, we're looking at Pakistan's nursing sector based on the sources you've shared. Now, on the face of it, you see this big increase in nursing graduates. Sounds good, right? More nurses, more care.
Well, yes, the numbers are going up significantly, but the sources really highlight a major catch. This boom in graduates comes from a rapid and seems largely unregulated expansion. The Pakistan Nursing Council, the PNC, they have approved loads of new nursing colleges. And while maybe the intention was good, boost the
It's
workforce.
created a quality problem.
Exactly. That's the core issue the sources are flagging. This quick proliferation, it raises serious questions about, well, are these graduates actually getting the quality of education and training they need?
Okay, so let's unpack that. If the numbers are rising, what's the flaw? What are these new places missing, according to the sources?
It seems many lack the absolute essentials. We're talking things like not enough experienced teachers, um, poor infrastructure,
Infrastructure, meaning labs,
yeah,
equipment.
yeah, labs, simulation tools, that sort of thing, and crucially, weak links to actual hospitals for clinical practice. The hands-on part.
Hmm.
It's a bit like trying to teach driving without a car or actual road time. And despite this, they're enrolling huge numbers of students. Quantity seems to be winning out over quality.
Right. And the impact of that, I imagine it's pretty serious. What does this mean day to day for patients and for the nurses themselves?
Oh, absolutely. The direct consequence is graduates who just aren't ready for real clinical work.
Hmm.
And that's not just theoretical. It directly impacts patient safety. Think about potential errors, compromised care. It also makes the workplace less safe for everyone, and, it really damages the reputation of the nursing profession overall.
That's worrying. Do the sources give any clue why this happened? Why approve so many colleges if the quality wasn't maybe fully vetted?
Well, it seems there was a strong push, and maybe a necessary one, to increase the number of nurses. For jobs both in Pakistan and maybe overseas. That's a valid goal. But the regulatory side, specifically the PNC's oversight, it just didn't seem to keep pace with how fast these new institutions were popping up.
Right.
The focus perhaps tilted too heavily towards just hitting targets, hitting numbers.
Okay. And the sources identify some key negative outcomes from this. What are the big costs we're seeing?
Yeah, they list three main drawbacks. First, and maybe most obviously, is just that lack of quality. This mismatch really eats away at trust, public trust, international trust in nurses trained in Pakistan.
Okay, lack of quality, that's one. What else?
Second, it actually fuels increased unemployment. You've got a flood of graduates who might be undertrained or unqualified for good positions, so they either can't find work or end up in very low-paying jobs.
Right, so it creates a bottleneck. And the third point.
The third is about decreased professional dignity. Think about experienced, highly trained nurses. Suddenly, they're being compared or lumped in with graduates from these perhaps lower standard programs. That's got to be incredibly demoralizing.
Wow. So quality erosion, unemployment, and this blow to professional dignity,
Yeah.
it really brings that question from the sources into sharp focus, doesn't it? Are we genuinely strengthening the health system here, or is it just numbers on a page?
Exactly. And the sources don't just leave it there, thankfully. They do point towards solutions. It boils down to collaboration, really. The PNC, nursing leaders, the colleges themselves, they need to work together. The key is prioritizing quality, tightening up those approval standards, and really backing the institutions that are committed to doing it right.
So it's not about stopping growth, but making sure it's the right kind of growth, sustainable quality growth.
Precisely.
It really hammers home that point from the source material. Nursing is more than just a job. It carries this immense responsibility. And making sure graduates are truly ready for that responsibility is paramount.
Absolutely. So for you listening, thinking about this, what does this whole situation tell us about the true cost when we let expansion in any critical field run unchecked? Maybe think about where else in society, beyond nursing, we might be seeing this tension where sheer numbers could potentially be overshadowing the actual capability and quality needed. Something to consider.